Retirement is often seen as a destination, but we believe it's an opportunity to pursue your passions, realize your dreams, and live a purposeful life. Great decisions, incredible lives. Retire with Intention podcast is about more than just money. It's about embracing the things that truly matter, the experiences, the relationships, and the impact you leave behind. Here is your host, John Creekmur.
Hey everybody, John here. Thank you so much for listening again to Great Decisions, Incredible Lives. It is so such a blessing to be with you all again today. And man, oh man, I'm just so excited to introduce you to a new friend of mine, Rachel Diaz, and phenomenal background. And I'll tell you what, as I've gotten to know her, not just an incredible mind, incredible way to look at things, an incredible background, just a great outlook on life also. And I know you're going to be blown away by the conversation today. And so looking forward to having her on the show. And so, hey, Rachel, real quickly, introduce yourself. Walk us through who you are, where you're from, and also your background is with Sphere. How did you get there, and what does Sphere do?
Sure. So first, thank you so much for having me on. Just listening to a few of the episodes, I'm so honored to be here. So yeah, a little bit about me. So I born in Havana, raised in Miami, and was interested in economics actually and public health kind of pretty early on. And so my background is in health economics, and I've been blessed with incredible mentors who have been very socially minded. And because of that, I ended up working for Yale University's Tobin Center for Economic Policy for a couple of years, and specifically at the height of the COVID-19 pandemic. And so one of my first big researcher projects was around skilled nursing facilities and tracking infectious diseases there. And again, a lot of people may know, but some don't, that COVID actually started in a nursing home in America, in Washington State. And so that's really where my big interest in public health came in, and how I eventually arrived at Sphere with that lens. And so to give a bit of background, a lot of people don't really know what public health is. So I will just give a very brief introduction. So when people think of health, a lot of the times they think of medicine, right? And so family physician, pediatrician, it's very kind of one-on-one looking at each patient and each person's health. Public health is a macro version of that. So whoever studies or works on public health, it's very much what sorts of programs or interventions or ways of living can improve community health, can improve the health of an enormous group of people at the same time, versus physicians focus on an individual basis. And so, having worked with skilled nursing facilities at the height of COVID-19, I knew I wanted to go back and, get my graduate degree in public health. But I specifically focused on social and behavioral sciences. So what are aspects in society that affect our health? So things like social connectivity, things like feeling support from your peers, things like feeling you have a sense of purpose, of mission every single day when you wake up. So how do those factors affect your health over time? And so now I am the director of senior living strategy at Sphere. And Sphere stands for Strategic Public Health Equities and Real Estate. So up until actually 2023, we were called Flagler Healthcare Investments, and we were essentially just a big healthcare investor, and we invested in long-term acute care hospitals. So we bought these kinds of facilities, helped develop them. So surgery centers, medical office buildings. And very recently, our CEO and our entire team realized, we have now the resources to make a bigger impact. So we can be smarter investors, and we can be more socially minded investors with a public health lens. And that's where I come in, because now we're getting into senior housing. And as investors and, owners of senior housing properties, we're not just acquiring properties, now we're assuming the management as well. So the risk and the beauty that comes with managing, senior housing operations. And so we definitely need a public health lens, because as a lot of us know, the silver tsunami is upon us of baby boomers, and we just have so much increasing demand in senior housing, and the bare minimum is not enough. So we are kind of really looking forward to bringing that healthcare lens into senior housing and just helping people live longer, healthier, and just more beautiful lives in their sunset years.
I'll tell you
So
what, Rachel, that's phenomenal introduction. I'll tell you this, the way you described how Sphere is really transformed from really a for-profit business where their singular focus was really on saying, hey, how do we maximize return to our investors? To where that is say, hey, we're in this space, we're doing well, that we're seeing huge impact as far as from the profitability standpoint. but
Mhm.
what can we do to make a bigger impact as far as for those that utilize services? And it's like that is a huge step forward. And this kind of, you had mentioned COVID, your personal start as far as in this space happened really during COVID time periods was a huge immersion, right? As far as in it. Was that also an impactful time for Sphere as far as kind of the way in which they process things?
Oh, definitely. I mean, everyone, whether you
Yeah.
were in the healthcare space or not, but especially being, owners of different healthcare properties, of course, it's not just about the profitability because all of our partners, right? Like all of our physicians, all of our medical providers that, were leasing from us at the time, they needed extra support. And so us as owners, as investors, we had to make sure that we were there, we were understanding them. We were coming into the office every single day, or at least virtually coming into the
Right,
office.
right.
And so, it's of course it's about making really intelligent investment decisions. And that's why we have over 1.2 billion, dollars of AUM, of assets under management. But it's also about taking care of your people. And the reason that we don't invest in just any properties, we want to make sure it's worth it and it's needed and there's demand. But we are also aligning with our tenants and the people that we are servicing and also even receiving care from because they're medical providers at the end of the day. And we'd want to treat them how we'd want them to treat our own family members. So yeah,
Hmm.
definitely a huge transformation.
And it's a lot of folks probably that are not aware of Sphere Investments. And I would encourage you folks to pop on. You'll see in the show notes, you'll see a link to sphereinvestments.com. It's SPHERE investments.com. And check out their site. A lot of interesting things happening on there. And one tab that really caught my interest, besides the background of the firm, equities, real estate opportunities, there's a tab at the top called Generations. I'll tell you, check that out and read that. You'll see a little bit more about what's being talked about here by Rachel as far as the philosophy of the firm and making a bigger impact as far as just with not just with their client base, just in all of society. And so very, very fascinating, fascinating company and check it out. And Rachel is a key part there as far as leading initiatives. And Rachel, walk me through, if you will. You mentioned COVID,
Mhm.
transformed time for everybody. And I still to this day, whenever I talk to someone, it's like, man, I've not talked to you forever. In the back of my mind, I'm thinking, were they wearing a mask or not? And so it obviously still impacts a lot of people. When you kind of think about that, what key lessons did you learn from managing risk in senior facilities during that period of time?
Yes. Oh my God. So many key lessons. I mean, there are still reports coming out about all the lessons we learned through COVID, but I think for me, it was two main lessons, and it was lessons in communication, effective communication, and trust. So trust building. Communication in terms of you can't just tell people what to do. Even if it's in their best interest, even if it's, for the good of themselves, society, public health, like telling someone versus explaining to someone. And by someone in this case is, right, somebody who's an older adult. It's kind of a generational thing. I'm reading a book called How to Say It to Seniors. And it's essentially like, people already feel such a loss of control when they get to a certain age, especially if they're not aging in their home. Just giving people back that sense of control to say, hey, this is what's going on. We want to make sure we're protecting you. These are the facts. We're going to really need you, whenever you can, like to wear this mask or to do whatever. And it's like, people are much more like amenable to those suggestions when you're not telling them and you're explaining. So definitely communication with the resident and the team. So there are entire care teams around older adults, right? Like at that stage, in skilled nursing facilities, but also in assisted living and memory care, everyone kind of needs to be on the same page. Like, how are we going to handle this? Like, what is the strategy? And obviously, when there's like a lack of time, it's difficult to make those decisions, but everyone really needs to be on the same page. And then just trust building. Like, it takes time to build trust. And in, cases of emergency like COVID, there's not a lot of time to do it. So I think one of the biggest lessons is building trust before an emergency happens, right? Like building trust with residents, building trust with care teams, just like making sure people know why you're there, what you're doing, and that you're there to support them so that God forbid an emergency, situation does come up, you're already ready and they're willing to listen to you and they trust what you have to say. So I think those two things were the biggest lessons with an added third of patience. Just so much patience. Okay, everyone is from a different background. People are scared. Just, to the extent that you can, take some time for yourself to relax so that you can have the patience to handle a situation like that later.
And such wisdom, such great words, and also I'm going to put a link to that book that David Soley wrote, "How to Say It to Seniors," and
Mhm.
He's a phenomenal resource, and that book just came out in September of this year. And
Oh,
I'd
good.
encourage everybody that is walking through things of life involving working with seniors, and all of us to do, right? We have generationally we have
Mhm.
contact points. That's a phenomenal recommendation of a book. We'll put that in the show notes as far as a link to get that. And make sure you check into it, Rachel. That's a great recommendation. Thank you so much. There at Sphere, one of the things I would love some more information on. It has to do with data
Mhm.
analytics. How are you guys using different tools just to improve healthcare outcomes for residents?
Yes, yes. And this is one of the entire team's favorite questions. I like to call us data heads because everything we do is data informed and evidence based. And so thankfully, we have an entire platform of data analytics that are backing our decisions. So not only our investment decisions in terms of like where is their greatest demand for senior housing and what segment of senior housing is most needed, so that we don't waste time and resources, but it's also how to improve resident health outcomes. And so we have access to, I can't even tell you how many data sets, both nationally and local data sets, to help inform our decisions in terms of how we're going to structure our communities, what kind of service offerings we're going to have. And so one example of that is, for example, our drug dashboard. So it's founded on Medicare data. So that's what it's based on. So everyone's 65 and up. And it shows the drugs that are being prescribed to patients nationally per county. So we can kind of see if a drug is being overprescribed or underprescribed. And if we happen to have a senior community in a market where a drug is being overprescribed, then we see we need to do a little bit more digging.
Mm,
So is it because those residents or, that demographic is sicker? Do they just, for example, have higher cholesterol than the rest of the state? Or are there potentially physician practices or medical practices that are just over prescribing this
mm,
specific drug, which is having real side effects for our
yeah,
residents? So
yeah,
at that
sure.
point, we can kind of raise, small red flags for us to go in and explore a little bit more and improve resident health outcomes through that exploration and through that detective work. And, not unfortunately, but it just is what it is. The senior housing industry hasn't been as data driven. And I think now that's changing. I
Yeah.
think people are realizing that we do need data. We do need to track resident health outcomes over time. We need to see what the surrounding community is suffering from, dealing with, because that directly impacts our residents. So we have a wide range of tools like that. We have a chronic condition trend dashboard. As we all know, people in 65 and up just have, increased risk of having overlapping chronic conditions and
Mhm.
comorbidities, all that come with their own health challenges. So we can actually map chronic conditions in different counties and different markets over time. So we can see like, okay, should we have a community there? When we have a community there, if we're developing, what kinds of physicians should we have around? Who do we need to outreach? So who do
Mm,
we need to outsource? Who do we need to bring into our
wow.
communities? And just make it a very targeted approach versus kind of like just shooting in the dark, hoping something sticks. We will know what our residents need and how that is impacting the surrounding community.
It's so true because so many, I'll say, companies in the past in this space, they were not relying on data to the extent that they should be. And maybe the data was they didn't see as readily available. Maybe they don't know how to quantify things. And so it affects outcomes, and not just from a profitability standpoint, but for quality of care and for
Exactly.
positive outcomes. And then for quality of health and quality of life, it affects so many areas. And so to use that to bring about influence, to bring about change even in providers in certain areas is so critically important, how it is all
Mhm.
works together.
And I do want to point out also, sometimes people don't know the data exists, but also a lot of senior housing managers and operators are focused on doing the work. So, there's only so much you can do sometimes of your day-to-day life, what you breathe is
Mhm.
sitting with a resident, listening to them, caring for them. Like sometimes you do need that external partner or collaborator to come in and help you visualize everything and work together to, create a strategic plan for your residents because
Mhm.
sometimes, I mean, people are just so focused on the daily care that they don't have time to kind of take that bigger picture view.
Yeah.
And so that's where we would come in and support and where we are supporting. And also just integrating with other digital health solutions. Like,
Mm.
data is supported by additional data. So we are looking at so many different suppliers in the market to see what other kinds of health trends we can track, whether it's like resident behaviors, resident mood, resident motivations. Like there's just so much potential that we're tapping into and it's only going to grow. So, yeah.
Well, what has your data really given you insights on when it comes to like intergenerational connections? Do you have data that shows the impact of seeing multiple generations actually being connected as far as with a health facility?
Yeah, we're really excited to actually be implementing pilot programs through Sphere Generations to see the actual concrete health outcomes
Yeah.
associated with intergenerational connection. And all of our efforts are founded on research that's already been done. So there is so much research out there, and I'm happy to link it for you and for listeners that just cites that social isolation specifically is associated, for example, with a 50% increased risk of developing dementia. So
What?
just the fact that you are socially isolated, you have a
Yeah.
50% increased risk of developing dementia. And it's not the only thing. You also have like around a 30 to 32% increased risk of stroke. So you're already taking, and this is across age groups, right? So you're already taking people 65 and up, potentially older adults that are already feeling socially isolated for many reasons. You have a loss of hearing, vision impairment, complications with travels and seeing family, potentially seeing your friends or family members pass away just due to old age. And you compound that with increased social isolation being felt all across America, across age groups, and it's a recipe for disaster. So that's really what Sphere Generations is focusing on, piloting programs to see, okay, what brings back connectedness, what brings back purpose, what brings back mission to our residents to avoid that and kind of bring value back to our older adults, to our elders, just to anyone that has the time to share their wisdom, because it doesn't just benefit seniors and older adults in terms of health, it also benefits youth that are potentially being mentored by them, and benefits children, it benefits everyone. And so that's again going back to public health. It's in everyone's best interest to take care of each other because we are all connected,
Yeah.
whether it's through infectious disease spread, whether it's through social connection, sharing wisdom. We want to strengthen that. And that's my biggest priority coming into this next year.
Yeah, and I know we're so connected in so many ways as it relates to health. I know even as far as policy decisions that we see out of our government leaders, both at the municipal level, the
Mhm.
state level, and then also at the federal level. There's just a lot of things going on. Even during election season, we always talk about
Yeah.
different programs, right? And so when I think about that, it's kind of like it all works together. Have you guys done research on what potential policy changes are really needed to support living communities?
Yes, yes. And that is an entire other podcast episode. So I'll focus on the biggest ones that we have been just getting up to date on and that we see are most important, and that is healthcare. So healthcare needs to be a part of senior residents' care continuum, right? Like the senior housing model cannot just be a hospitality model because we are inherently caring for some of the nation's most vulnerable and sometimes most sick. And if they're not there yet, they have a large predisposition and large risks just because of their age. So healthcare needs to be a part of that care continuum. And specifically, we're now starting to get into value-based care
Hmm.
models. So some listeners may have heard about VBC, some may have not, but it's essentially just creating wraparound health by providing holistic care teams that come in and take care of the residents. So whether that's the nurse practitioner, the physician, the therapist, senior housing providers ourselves. So it's just all of these people coming together to decrease healthcare costs by improving health outcomes in the most cost-effective way possible.
Hmm.
It's every aspect of a person's health is being addressed. And so there have been already government sponsored VBC programs like ACO REACH, special needs programs, but they're being piloted. And a lot of success is being shown in senior communities and beyond. But some of these programs are sunsetting in 2026. So, like ACO REACH is expected to sunset in 2026, but we're seeing that it's providing a lot of value to just society at large. So, despite the clear benefits, some models are being sunsetted, and these policies are really needed to sustain and support these kinds of models in the long term. If we're seeing that the basic fee for service model is not working as well as it should, or our healthcare prices are just skyrocketing,
Mm,
clearly there needs to be an addition of something else. And so
mhm,
value-based care could
mhm.
be that thing. We need more time to figure out if that's the case.
Yeah.
So definitely, yeah.
Yeah, there's so many different areas. And I mean, I love the fact of your research and what we're seeing from that research. And we kind of think about research that also gives us an insight as far as future trends that we were going to see coming. And
Mhm.
you've already laid out a number of different trends that you guys are on the front end of things and developing generations. I think is a huge trendsetter, quite honestly. And so when you kind of think about that, what other trends do you see shaping the future of senior living?
Yes, there are so many exciting trends. So we've looked at many surveys on baby boomers in general, and the Pew Research Institute showed that baby boomers in the next 6 years are more diverse, more independent, more
Mhm.
educated, and wealthier. So they control 65% of US net worth today. And so this means that they have higher needs, higher standards, reasonably so. And they're also entering senior housing older at around 80 years old on average today. So senior housing trends need to keep up with that. We need to create communities that are more adaptive to this demographics demands. And specifically, some examples are more tasteful and functional design. So a lot of senior housing properties are older. They're 20 years old or older. They're not necessarily as aesthetic to look at, or they're not as comfortable, or they don't have all of these design features that can kind of adapt to the person that wants to age in place. Like you don't
Mhm.
want to have to move if you have, increased needs for activities of daily living. You want your home, your house, your apartment to adapt to you, right? And so we're definitely going to have to start thinking about that in terms of design. There's also this rise in university-based senior living communities
Mhm.
because so many older adults realize, thankfully, like you can still learn. You still have this insatiable curiosity. You can still contribute so much to society or just learn for your own pleasure. And you can actually live on or near a university research campus.
Wow.
So there's been so much of that. And then finally, just like community integration. So that goes a little bit of, it goes with the social isolation, combating social
Mhm.
isolation. How can we make sure that almost every aspect that you can think of is at your fingertips? Kind of like when you're in college. Like if you want to get a haircut, the salon is right there, or it's inside of your actual building. If you want to get your nails done, if you want to go see, regular doctor checkup, if you want to listen to live music, or, have your son or your daughter over for a drink, you can have that within your actual community. So how do we design around community integration in a way that feels authentic and it feels real, and it invites other people from outside of the senior community to come inside and share, those special moments? So all of these are definitely informed by, the rising baby boomer population, their tastes, and just, yeah, they need to just prioritize living the life that they want to live. So how can we help them do that in a way that also improves their health?
Yeah,
Um,
yeah. It's
yeah.
interesting. My wife Stacy and I, we were sitting down talking with friends of ours, and we're all, I'm going to say, mid-50s. And so we also are primary advocates for healthcare for our parents and helping them as they kind of walk through that next stage of life. And we were all kind of sitting around joking the senior living facilities that we're going to need, I'll say in 20 years, 25 years, whatever it might be, it's going to look a lot different than what we saw 20 years ago. And so
Yes.
expectations are different. The standard of care is different. And so that's an ever evolving, changing world. And one of the things that's been a big change that I've seen over my 30 years of my career is just longevity, how
Hmm.
long people are living. And I know that's a big topic, a big question. And we know that it's going to get longer and longer as we see more advances as far as in healthcare and the
Hmm.
way in which we care for ourselves and things like that. Well, that plays right into an individual's financial planning. And so, have you seen ways where a retiree or a pre-retiree can align their financial planning with that whole concept of increased longevity and the additional need of like in different types of senior living arrangements?
Yes, definitely. I mean, it's a great question, and it's what we're seeing the most. People being like, okay, well, I want that beautiful community, with my friends who are like the same age in their 60s and their 70s, 80s is the average age that people are coming into senior housing now, as I mentioned. And
Hmm.
so, of course, you need to plan. We need to plan. We need to plan ahead of time. And like, if people haven't started, the best time is now. So it's definitely, it's a struggle, right? Because obviously the goal is to increase the longevity and the quality of that life, right? But that also means we're spending more money the
Mm,
longer we live and the more
mm,
characteristics that we want and we should rightfully have. So you know better than I do, and that anyone does really, how important financial planning is, because yeah, I mean, the last thing you want to do is like get to that age and then realize, okay, I want to travel the world and I want to learn and I want to do all these things, but how? Like, how am I going to get there? So ideally, like, I'm already thinking about this for my own grandparents, for my own parents. It's like the earlier you can sit down with someone and figure out what your goals are and what you want your life to look like, the easier it's going to
mm,
be. And it's also a question for senior housing providers. If we realize that our residents can't meet the financial demands that they thought they could, how are we going to circumvent that? What
mm,
community programs can we rely on? What partnerships can we make to get that person back on their feet? This is not just about a profit issue. It's about a societal issue. It's
yeah.
about supporting your neighbor, supporting your residents as much as you can, and figuring that out together.
Mm. Now, I'll tell you what, guys, that's a huge question. That's a big question, quite honestly, is how do we plan for that? And I know, a number of great resources for sure. Check out sphereinvestments.com. There's a number of different drop-down menus that can kind of prompt some thinking that I would encourage you to think through. Make sure you connect with whoever your advisors are, and then also with your family, and sit down and have some conversations about planning for that. Maybe it's 5 years in the future, maybe it's 30 years in the future. But when we're talking about, let's like Rachel said, we're talking about planning. You can never begin too soon to at least have initial thoughts. And we see it as a huge risk, quite honestly, financially, and then for intergenerational planning, that if we don't plan for it, those dollars disappear, and you want to make sure it's all coordinated together. Rachel, we've covered a ton of stuff. You have a ton of knowledge and background and research. We've covered a lot, but is there anything we've not talked about that you think, hey, right now it might be helpful to leave with people? One final thought to kind of help them as far as in their thoughts?
Yeah, that's a great question. I would just say the wave of, that silver tsunami really is upon
Mm,
us. And I think it's important for us to remember the lives that were lived by people, by older adults, and the value that they bring.
mm,
And they're not done providing value. Whoever is listening, whether it's you, whether it's a parent, a family member, a friend, like the importance of making the time to listen
mhm,
and to connect with our older adults. It's not just for them, it's for us.
mhm,
They finally have the time to sit down and share a life's worth of opportunities, of experiences. And that's a reminder for everyone and myself too, just make the
right,
time, make the
right.
time. It will always be worth it.
Phenomenal of that, and just the thought, just to make the time to connect. And
Yeah.
something we all need in our lives is that human connection. And sometimes the business of a life takes us away from it. I mean, that's an excuse. We need to be intentional and make the time to do it. Rachel, thank you so much for the time today. So enjoyed our conversation. And I think you did tease a little bit. I think we'll do another episode together on a couple other topics. And so very
I would love
beneficial.
to.
And everybody, make sure you check out the show notes as far as the number of links in there that you'll find really valuable. And also, if you haven't had a chance, we have put together into a book called Your Blueprint for Purpose, Build the Life You've Always Dreamed About. A couple of weeks ago, it was named as Amazon.com #1 seller in 3 or 4 different categories. It was the actual #1 launch of a new product, Amazon.com, a couple of weeks ago, and so it kind of rocked it. It's a history of 12 episodes from the show the last year, and so give you a chance to reconnect, and also links to those. And so make sure if you've not got a copy of that, make sure you pick up a copy of that. That's very cool. Otherwise, everybody, thank you so much for listening. We'll connect with you next week right here on Great Decisions, Incredible Lives. Talk to y'all later. Bye-bye.
Thank you again for listening to the Great Decisions, Incredible Lives, Retire with Intention podcast with host John Creekmur. Follow us on social media, visit our website, and join our community of like-minded individuals redefining retirement and living incredible lives. Please leave us a review and share our podcast with others who may benefit. We wish you a future filled with purpose, fulfillment, and the joy of living your incredible life in retirement.